The health impasse in the country. The doctors are holding their ground in terms of the strike still being on, while the government is urging them to actually, listen to what they've put on the table and go back to work. But the impasse still stands. We'll definitely keep you updated in terms of the whole government approach and the negotiations so far with the health unions. But right now, I want us to shift focus to Martyrs Malaria. Remember, the globe just yesterday marked World Malaria Day. And of course, this brings into sharp focus the steps that have been taken so far to make sure that malaria is not as big of a problem as it used to be in the yesteryears. Now, despite various efforts that have been made by government, malaria remains a serious global health challenge, and it definitely needs the attention we're giving it right now. So we set to have a conversation on Martyrs Malaria. So we get to understand what are the signs, what are the symptoms, especially during the heavy raining season, where there could be water puddles left, right, and center that might actually make the mosquitoes increase in numbers. Equally, we'll take a look at the risk factors around malaria when it comes to pregnant women, the drug resistance angle, and equally the social aspect of malaria. And joining me in studio to help us deliberate on this matters and more, I'm joined by Dr. Hilary Tarus, who's a medical officer at the current hospital right here in the country. Karibu sana, Daktari. It's great to have you with us.
Thank you very much.
And perhaps you can start on a light note. I expected you to be on the streets, so you leave that to your fellow compatriots.
In the afternoon.
In the afternoon. Okay,
Yeah.
that's really noted. And we're having this conversation at a time when the country is experiencing heavy rainfall. And at times, this comes with water puddles that might collect in certain areas and might increase the number of mosquitoes in the country. If you ask any household, no matter how simple it is, they will know when it rains, mosquitoes increase. So let's start from that point. Bearing in mind the anticipated increase in mosquitoes across the country due to the heavy rainfall we're experiencing, how should we go about this? Yeah.
I think first of all, it's important to understand that in the early life stages of a mosquito, it's an aquatic organism. The children of mosquito actually are actually living in the water, the mosquito larvae. So that is the basis behind the rainy season and the increase in mosquitoes. So what you can do is try to clear all the stagnant puddles around your house. You can try to remove all old tins that have collected water. If there is a huge puddle, this is something that you can do. You can actually take crude oil and pour it over the water. So the science behind that is that it will suffocate the mosquito larva from accessing oxygen.
Okay. Well, but that's definitely a simple approach in terms of getting rid of the mosquito larvae in the puddles. But let's get to malaria as it is. I've mentioned that, it still remains a serious global health challenge. And right here in the country, we've seen concerted effort by various government organizations, non-government organizations to help quell this situation. What exactly is malaria from a medical point of view, and kindly break it down in terms of layman's language so we can all understand? Yeah.
All right. So something interesting that I do is that when I diagnose a patient with malaria, I always ask them, what causes malaria? And 9 out of 10 times they will say it's the mosquito, which is not the case.
Are you serious?
No.
Okay.
It's not the mosquito. It's actually a small microorganism called the plasmodium, which lives in the body of the mosquito, in the salivary glands of the mosquito. So the plasmodium malaria is the culprit that causes malaria. The plasmodium. There's many types. There's plasmodium malarium, there's falciparum, there's ovale, there's vivax, there's knowlesi. But the plasmodium falciparum is the one that is implicated most in cases of malaria in sub-Saharan Africa. So you get malaria when a mosquito, and not just any mosquito, there's many types of mosquitoes. In specific, there's the one called the Anopheles mosquito. And not just any Anopheles mosquito, but it's the female Anopheles mosquito, the one that causes malaria. So you get it when an infected female Anopheles mosquito will come and bite you and draw blood from you. And in that process, some of the parasites can transverse into your bloodstream.
You said there are many types of mosquitoes, equally different types of malaria. Let's talk about them in terms of what you see most commonly.
Different
in
types
terms
of plasmodium.
Of plasmodium, not
Yes,
malaria.
yeah.
Okay, that's well noted. Then let's talk about the symptoms then. Because does it manifest differently in people, irrespective of the age group? Is it more severe in children, in pregnant women? Give us these classifications, yeah.
It's more likely to be severe in children under the age of 5 and pregnant women. But generally, the symptoms of malaria is fever, general body weakness, joint pains. You can have what we call rigor, where you feel a sudden burst of chills and coldness followed by sweating. These are the signs that you would see in malaria. Vomiting and diarrhea is also part of the symptoms. Now, when you get malaria, it can come as a much mild form of malaria. We call it uncomplicated malaria, which will have the symptoms that I've mentioned. But in some cases, if treatment is not given early, or if there are comorbidities or factors that influence the immunity of the patient, they can develop what is known as complicated malaria. So with complicated malaria is where you have now the symptoms affecting or attacking different organs of the body. Let me give you an example. If it attacks your brain, you have what is called cerebral malaria, which is a medical emergency. If it attacks your lungs, you can have what we call pulmonary edema, where there's fluid collection in your lungs, making it difficult for you to breathe. If it comes to your kidneys, you can have a kidney injury. Your kidney function can be impaired. Now, complicated malaria is a medical emergency.
Okay.
Yeah.
And we'll definitely get into the nitty-gritty details. Right. But still, in terms of prevention, because they say prevention is better than cure, what's the most scientifically acclaimed way of preventing malaria? So many hype around mosquito nets and how practical they are, especially in low-income households. But we have other advancements in terms of, is it lotion that is mosquito repellent? Are these as effective, perhaps, as the mosquito nets that should be treated?
Yes, yes, they are. There's a simple way of protecting yourself from malaria, like using the mosquito repellents, especially in areas of your body that are exposed. You can sleep under a treated mosquito net, which has been seen to have to be very effective against the prevention of malaria. Like, the mosquitoes come out at night. That's when you're asleep. Sleeping under a treated mosquito net could actually save your life or the life of a loved one.
And what about those who might find themselves traveling on a day-to-day? How best should you prepare to prevent such instances where malaria, is definitely a cause of concern? Perhaps you're going to far-flung areas where, malaria is definitely a cause of concern. How do you prepare in advance? Because if you're going to, we hear polio vaccines, yellow fever vaccines, is there something to do to prevent malaria in terms of anticipation? Yeah.
Okay. So at present, there is no government-approved malaria vaccine.
Okay.
But we do have medications that are called prophylaxis that you take up some few days prior to your travel and about some few days after you come back from the area of the region that you've traveled. So we have specific areas in Kenya where we call them malaria endemic zones, which means people from that, we see a lot of malaria cases from those regions, mainly due to mostly the weather, the temperature. And also, number two, the closeness to a large water body. On temperature, I'll say this, the malaria plasmodium does very well in temperatures above 20 degrees Celsius. Okay. So if you have a place that, there is presence of places where the mosquitoes can breed and good temperature, that place can become a malaria endemic zone. Number one is the Kisumu, the Nyanza region. And also you have the coastal region
as well.
Yeah.
Okay, so we definitely urge residents in those areas to, be of utmost concern when it comes to preventing malaria. So let's get to the treatment part, because a little bit earlier on you mentioned that if you have any other underlying symptoms, malaria might be even worse. It can affect brain, lungs, various areas. So how do we approach when it comes to treatment? And let's start with the minors, because I'm pretty sure the treatment approach is different. Minors, pregnant women, and then someone who's considered upright and healthy here.
Yeah. So the treatment of malaria is actually very simple. We have a few drugs that have been shown to be very effective in treatment of malaria. We have what you call the quinolones. Here you have your quinines, you have lumefantrine, and then you have the others like the more advanced called artesunate. So your choice of treatment will depend on two things. Of course, is it a pregnant woman or is it a person who is not pregnant or a male? Of course, there are certain medications that are contraindicated in a pregnant woman. The second thing you have to consider is how bad is this malaria? Is it the uncomplicated or is it the complicated? So for the complicated, we always insist on IV medication as opposed to oral medication. And of course, you have to monitor these organs that I've mentioned and support them in case there is any issues. For most people who have malaria, who have gotten malaria, who are probably listening to this show right now, have probably had the uncomplicated. So for the uncomplicated, just go to the pharmacy, get we call it Coatem, artemether lumefantrine, the combination. It's only 100 shillings.
Yes. Yeah. And it definitely helps. It'll do it.
Works, yes.
Okay, that's for the complicated or the not uncomplicated. Okay, that's really proper. And when it comes to pregnant women, you mentioned that of course the treatment is a little bit different. Why is that, and how high is the mortality rate when it comes to pregnant women? Because I've seen so much emphasis in terms of protecting children and pregnant women when it comes to malaria.
So when we talk about pregnant women, we are first of all concerned that during pregnancy, the immunity is stepped down a bit.
Okay.
That's number one. Number two, when you're treating a pregnant woman, you're treating two patients. And then there's a whole cluster of complications or risks that come when a pregnant woman gets malaria. So remember when I told you the mosquito has bitten you, now you have the parasites in your blood system. So what happens is that they go to the liver. From the liver, they multiply, and then they start attacking your red blood cells.
Okay.
And then the numbers of the parasites start to increase. Of course, this is in the event that you have not yet sought treatment or adequate treatment. So with the pregnant mother, you're afraid that there could be an accumulation, if you will, of these parasites in the placenta, causing a condition called placental malaria. Now, placental malaria is very detrimental to the fetus because the placenta is it's that organ that facilitates communication between the mother and her child.
Okay.
Sends nutrients and food to the child. So this ability for the mother to communicate with the child is severely impaired in the case of placental malaria. So leading to conditions like a stillbirth, an intrauterine death, something we call intrauterine growth retardation, where the child is not growing adequately. You do an ultrasound of a child who is supposed to be 7 months, but he appears to be 3 months. It can cause a preterm birth. It can cause a birth of a child who is low birth weight.
So the effects are adverse, hence the high level of caution that's needed.
High level of caution, and then that's why we give what is IV artesunate is very good.
Okay.
Yes, which is a step up from the quinolones.
That's interesting. When we come back from a short break, I'd like to know whether self-medication can put you at more harm. Because I hear this sort of analogy that if you go for the painkillers when you feel your head aching, when you go for the fever medication, when you feel yourself, convulsing fever here and there, it might actually make the situation worse. You're treating the symptoms, not the disease. So we'll come to that in terms of drug resistance as we take a look at other factors that are uprising when it comes to Malaria Day. Just remember, yesterday the